Hello everyone. Today we are going to discuss about admission and discharge procedure of mentally ill person in a mental health hospital. So what is the meaning of admission? We used to hear admitting the patient. For what purpose we are admitting the patient in the hospital? Is there any type of admission that we are going to discuss today in a general way? What's the meaning of people admitted in the hospital? That we will see first. People are admitted to hospital when they are affected with a serious or life-threatening problem to get adequate care on time to time. So that's the purpose of admitting the people in the hospital. So it might be because of less serious problem or because of life-threatening problem. But for what purpose? To get adequate care, and that too time to time. So for that purpose, we are admitting the people in the hospital or patients in the hospital. And regarding the admission procedure and discharge procedure of mentally ill people, regarding that you have to listen the video on Mental Health Care Act chapter 4. Okay, so the below mentioned link will give the information about chapter 4 of Mental Health Care Act, and you have to listen that. Then you will get more understanding about the admission procedure and discharge procedure of mentally ill person. Here we are generally discussing what is admission, what's the purpose of admission, and types of admission. We will see the types of admission first. There are four types of admissions we can see. Formal admission or involuntary admission, informal admission or voluntary admission, emergency admission, emergency involuntary admission. These are all the major types of admissions we can see in the hospital. First, we will see what is formal admission or involuntary admission or informal admission or voluntary admission. So, what is informal admission or voluntary admission? The person agree to their admission are referred to as voluntary or informal admission. Okay, don't get confused while reading this word voluntary admission. That is informal admission. Voluntary means what? The patients are agreeing that, or patients are ready to go to the hospital, or they themselves going to the hospital for their admission. That is voluntary admission. So voluntarily the patients are going. So there is no formal procedures are there. So this kind of admission is known as informal admission. And voluntary patient can discharge themselves and leave hospital at any time without the agreement of staff, because there is no agreement between the hospital team and the patient or patient's family. And voluntarily the patients have come here, so voluntarily they can go back. And there is no need of any special permission from the hospital higher authority or from the hospital department. But there is a provision to stop the voluntary patients discharging themselves if they are seriously mentally unwell or mentally ill. That's the point you have to keep it in your mind. Of course, they are informal patients. They are not here without any formalities. But in some cases, okay, if the condition is not much good and if they are unwell, means in that case, the hospital can stop discharging the patient from the hospital. This is about informal admission or voluntary admission. Don't get confused. Informal, why we are telling means there is no formalities we are following in this case of admission, that is informal admission. Why we are calling this as voluntary admission is voluntarily, without any force, voluntarily the patient is coming. That's what it is known as voluntary admission. Next is formal admission or involuntary admission. Okay, formal admission means there will be some protocols will be there, procedures will be there, and not patient is coming. Sometimes forcefully we are taking the patient to the hospital due to their mental health condition. So we are telling that is involuntary admission. So formal admission means the patients admitted to hospital under the section of Mental Health Act. So we are following some norms, rules and regulations for admitting the patient in the hospital. So we are following some sections of Mental Health Act, and that patient is referred to as formal patients. And all these sections and how these norms will be there means chapter 4 of Mental Health Act will give more information. So please watch that video to understand the procedures of formal admission of psychiatric patients in a psychiatric hospital. So formal admission means, again I am telling, the patients are admitted to hospital under the section of Mental Health Act, and the patient is referred to as formal patient, and they must remain in the hospital even they don't want to for the particular periods to receive treatment. It's not depend upon their likes and dislikes. It's depend upon some formalities. It's depend upon some procedure, because they are mentally unwell. It's cleared, and it is cleared, and it is accepted by the authority. So they will give information regarding the discharge, and also they must remain in the hospital even if they don't want to stay in the hospital. This is known as formal admission or involuntary. Why they are telling formal means there is some formalities we are following in the admission. At the same time, involuntary, because voluntarily the patient is not coming. Sometimes forcefully parents or family members or the caregiver is taking the patient to the hospital. So that is known as involuntary admission. Two more types of admission we can see: emergency admission and emergency involuntary admission. Emergency admission means the patient is able to get admission for 72 hours without patient consent or guardian if a designated mental health doctor says that the emergency admission is necessary. So if the designated health doctor or mental health doctor is telling that the admission is necessary, means in that case the patient is able to get admission for 72 hours without the patient's consent or the guardian's consent. That is known as emergency admission. Then last one more admission is there, that is emergency involuntary admission. You know what is involuntary admission? That is informal admission. Involuntary admission or formal admission. So what is emergency formal admission or emergency involuntary admission? Means that the patient is able to get admission for 72 hours on the authority of governor as a result of examination by single mental health doctor if a hospital cannot complete the official procedure. That is known as emergency involuntary admission. So these are all the four types of admissions we can see in a mental health hospital. Then we will see ward activity. What are all the ward activities we can see? That means in the hospital, inside the hospital, once they are admitted in the hospital, what are all the regular general basic ward activities we can see? After admission, all the activities in the ward will be depend upon the needs of the patients. Of course, all the activities depend upon the need of the patient, and medication will give to the patient as per the doctor's order, day, night, and daytime and night. So medication will give as per the doctor's order. Then choice of meal and drink is depend upon the patient needs. Of course, it is depend upon the patient needs, and visiting time is fairly flexible with some ward and under restricted in some ward. So in some ward visiting is allowed and some wards visiting is not allowed, and it's all depend upon the condition of the patient, and doctors will do ward rounds daily to provide up-to-date planning of treatment. So these are all some general ward activities we can see after admitting the patient in the hospital. Either it is voluntary, involuntary, emergency or emergency involuntary. Then we will see discharge. After completing the procedure or after completing the treatment, we will leave the patient from the hospital. That is known as discharge. According to Mental Health Care Act 2017, proper discharge planning should be done and documented before any discharge. That's very important. So before discharging, we have to document everything: progress of care, what are the things we have planned, what are all the things we have implemented, and what is the evaluation, and all the things we have to document properly. And discharge planning should be based on complete health, that means physical, mental assessment of the patient, and we have to involve the family members in the procedure. Then for referral to other services, take necessary steps, and before discharge, assess the patient completely. That means capacity for self-care, their clinical needs and other needs. So we have to assess all the things: their capacity for self-care, their clinical needs and other needs, and after that only you have to plan the discharge. Then we will see what are all the aims of discharge. Assisting with re-entry to normal life. Of course, that's the first and foremost aim of discharge. We have to assist with re-entry to the normal life. Then to continue and coordinate the care. That means follow up. Then minimizing the chance of immediate return to the hospital. So we have to give maximum continuing care to the patients to minimize the chance of immediate return to the hospital, and preventing homelessness and suicide. Of course, psychological support is necessary to avoid this homelessness and suicide, and support from crisis and relapse, and optimal health and well-being for the patient. These are all the basic aims of discharge process. Then we can say discharge planning is a mandatory procedure and verified document that is the goal set at time of admission and target achieved at the time of discharge. That is very important. So while planning discharge, you have to think what are all the things you have planned, whether you have achieved the goal or not achieved the goals, whether you have reached the goal at the time of discharge. What were all the things we have planned at the time of admission? That you have to check during the time of discharge, and discharge planning should begin as soon as possible after the patient admitted in the hospital. So these are all things you have to follow in the discharge procedures. So this is about discharge and admission of the patient in mental health hospital. So admission of psychiatric patient in the psychiatric hospital means admitting the patient either less serious or life-threatening problem. For what means to give maximum care to the patient based on their needs. And there are 4 types of admission we can see: voluntary, involuntary, emergency, and emergency involuntary. And after that we have seen what is discharge and the procedures and aims of discharge. This is about admission and discharge of mentally ill patient in the mental health hospital. This is the general information. Regarding the details of admission and discharge procedures of mental health patient, you can see in chapter 4 of Mental Health Act. You have to see the previous video to get more information about that. That's all for today. Thank you.